I think that ventricular tachycardia ablation is still considered by some EP doctors and some centers as complex procedure. And honestly, they're right. It is a complex procedure. And also a procedure that is associated with potentially more complications than a more standard, let's say, ablation procedure. Even proximal AF ablation is considered way simpler than VT ablation. Now, I think that when it comes to post-MI VT, it can be relatively simple. Not to say that nothing may happen. Of course, complications can always happen. But the process we just described earlier today, where you just register your images, you have a really accurate description of the substrate, you get there, do your ablation, and you're done within 2 hours. It's a really significant simplification of the procedure. It makes it also much more efficient for the lab occupancy. You know that it's going to be a 2 hours procedure. We have the exact value is 110 minutes plus minus 25 minutes. So it's a very narrow standard deviation, which makes the duration predictable. And that's important for centers who want to optimize their lab time, and they know how much time it will take. And that's quite new in the world of VT ablation. I also think that this should translate into a superior safety, because shorter procedures typically are associated with better safety. And so I'm not going here to say that it becomes as simple as paroxysmal AF ablation, which is not always simple, but is simpler. It's not to that point, but we're getting closer to that as compared to what we used to do in the early days, where we were spending hours inducing VT and mapping VT and having drops in the blood pressure. And, you know, even if it's not 5 systolic blood pressure we're talking about, even if it's 8, it's not good for the patient. If the patient is used to 12, it's not the same. And I think it's not completely trivial, particularly in elderly patients, where the kidney is going to suffer from that, etc. And so the patient experience and the recovery is clearly improved by these short VT ablation procedures.